So could I invite up to the stage Dr. Karen Canfell, who is going to talk, I'm not quite sure what she's going to talk about, towards cervical cancer elimination, the role of universal healthcare. Thanks.
Thank you very much, Charles, and it's my honour to be here to tell you about the major developments and the global impetus and excitement towards achieving cervical cancer elimination. And sadly, cervical cancer, which is still an entirely preventable and treatable disease, there are still 570,000 women diagnosed every year, 311,000 women dying from cervical cancer. And it's the most common cause of cancer death in 42 countries, in sub-Saharan Africa, in parts of Asia, and in parts of Latin America. But the dream of eliminating cervical cancer is becoming a reality, and I'm excited to be here today to show you some new evidence on the projections forward if we can achieve concerted action. So in May last year, Dr. Tedros, the Director General of WHO, called for all countries to take action to help end the suffering caused by cervical cancer. And in January this year, the Executive Board of WHO called for the development of a draft strategic plan defining clear goals and targets for the period from 2020 to 2030 towards achieving cervical cancer elimination. Now, clearly, cervical cancer elimination has to be enabled by a system of universal health coverage, and it's entirely contiguous with the goals of universal health coverage. So cervical cancer prevention, treatment, and early detection involves action across the cancer control spectrum, and this is enabled by UHC systems. So the WHO draft strategic plan for 2030 requires scale up to the 90-70-90 targets. 90% of girls fully vaccinated by age 15. 70% of women screened twice in a lifetime around the ages of 35 and 45. And 90% of women identified with pre-cancer or cancer effectively treated, with a proposed threshold for elimination as a public health problem of 4 cervical cancers per 100,000 women per annum. In doing so, the objective is to realise the Sustainable Development Goal in relation to this disease, a 30% or 1/3 reduction in mortality from cervical cancer by 2030. Now, why do we think it's possible? Well, I'm going to turn briefly to my own country, Australia, and tell you about a successful experience enabled by a UHC system. Australia was the first country in the world to introduce a national free public vaccination program, which was supported by a successful health promotion campaign. And it's achieved high coverage of 90, 86 and 80% for dose 1, 2, 3 coverage in girls. As the program was rolling out, the modelling of the impact suggested a rapid effect. This is the pre-vaccination pattern. Within a few years, infections dropped. And this has in fact been shown to be the case. On the right, we see the data for vaccine-included HPV infections from 2018. So this rapid impact in terms of infections means that young generations of girls are at much lower risk of ever developing cervical cancer. But older generations of women remain at risk, and so cervical screening has an incredibly important role and will continue to do so. And in Australia, we have recently transitioned to the next generation screening test, HPV screening, and we have achieved high coverage across age groups for screening, again, enabled by a UHC system. This is all in the context of broad access to cervical pre-cancer and cancer treatment. And in our country, we've demonstrated survival from cervical cancer at 5 years, 73% overall, 80% for women under the age of 70. And for women surviving more than 10 years, their survival is essentially the same as women in the general population. This is a curable disease for women that develop invasive cancer. But none of this has been without challenges, and it continues to have challenges. And there's a disproportionate burden of disease in Indigenous women. and further action is still required to address inequities. There are many implementation challenges around the screening transition, including laboratory workforce transition, developing appropriate models for delivery of HPV, testing, and the development of the IT support systems to support the program. But despite these challenges, Australia is now on track to be the first country in the world to eliminate cervical cancer, with a predicted timing within the next decade, by 2028. And in fact, Australia can soon start talking about disinvesting in cervical screening for those younger generations of women who have access to new next-generation vaccines. Even if there is no cervical screening at all in these very young generations as they age, Australia will remain under the threshold for cervical cancer elimination. So the key steps towards elimination in a UHC framework, this is a template. Access to broad-spectrum vaccine for adolescents, access to HPV screening for women, and access to high-quality treatment services for pre-cancer and cancer as a means to ensure increasing impact and equity of outcomes. So what does this mean at the global level? Well, unfortunately, if we don't take concerted action, the picture is rather grim. 600,000 cases of cervical cancer expected in 2020, doubling in the next half century and tripling by the end of the century. With the vaccine uptake achieved to 2014, mostly in high-income countries, 1 million cases have been averted in the next half century. If we can scale up vaccination in low and middle-income countries, though, the picture will be very different. And depending on the vaccine type, we can avert between 5 and 8 million cases of cervical cancer in the next half century. But you'll notice one thing. It takes time for the long-term protective effect of HPV vaccination to turn around the global tide of cervical cancer. And so it's really combining vaccination with twice-in-a-lifetime screening that will bring forward the benefits of protection and avert over 13 million cases of cervical cancer in the next half century. Building on these results, the WHO Global Cervical Cancer Elimination Modelling Consortium has been working to develop models of the impact and the cost effectiveness of cervical cancer elimination strategies in 78 low and lower middle income countries. And our findings show that in the vast majority, 95% of countries, scale up to the 90, 70, 90, 2030 WHO targets will not only result in elimination, but will also be cost effective. This means that the combined strategy scale up to the 90, 70, 90 targets for vaccination, screening and treatment will be more cost effective than vaccinating girls alone, will be more cost effective than vaccinating girls and boys, and will be more cost effective than vaccinating girls combined with once lifetime screening. The most cost effective option will be vaccinating, twice lifetime screening and scaling up cancer treatment services. What does this mean for cervical cancer mortality? Well, compared to the situation if we do no more, the elimination strategy will result in a 1/3 reduction by 2030, predominantly due to the scale-up of cancer treatment services, a 2/3 reduction in cervical cancer mortality by 2045, and in this period, this is due to the downstaging and protective effect of cervical screening, and a 98% reduction as the effect of the HPV vaccination scale-up kicks in by 2090. This, therefore, will enable us meeting the SDG Goal 3 in relation to this disease, a 1/3 reduction in cervical cancer mortality by 2030. This also implies many millions of women will have their lives saved. So in terms of cervical cancer deaths averted, 2 million by 2040, 4.5 million by 2050, and 62 million women's lives will be saved by 2120. So with these benefits, as Dr. Tedros has said, failure is not an option. It's not just benefits to women, it's benefits to families, societies, and economies. And we have to bear in mind, I think, that cervical cancer elimination will not only be enabled by, but will assist in the development of resilient and sustainable UHC systems. And it will require linkage with other key UHC platform areas, national vaccination programs, community and primary care, HIV services, the contact points for the highest burden of disease, highest risk women, sexual and reproductive health services, addressing stigma and building cancer literacy in communities, and of course, scale up of cancer treatment and palliation services. Cervical cancer elimination will also have broader implications for cancer control within UHC and should help enable the development of a virtuous circle, including better understanding of the national context and identifying inequities in cancer control, identifying priority, effective and cost-effective interventions, planning for implementation, and monitoring and evaluating impact. And the infrastructure created to achieve cervical cancer elimination should be able to be harnessed for control of other cancers. So as we meet here today in Nur Sultan, the Kazakh nation is about to celebrate the 175th anniversary of the birth of the great poet Abay. And his words are as applicable to us today as they were in his lifetime. Those who seek learning should know certain essential conditions without which they cannot achieve their goals. Our essential conditions are the building of resilient and sustainable health systems. Our goals are the achieving of the Sustainable Development Goals, the 30% reduction of cervical cancer elimination, of cervical cancer by 2030, and the ultimate elimination of this disease. Thank you for your attention.
Thank you very much, Karen. Fascinating, and I think we'd been assuming to some degree that it was really just vaccinations and screening and the management of precancerous lesions that would be important, but actually you're talking about treatment too, and it seems to me having that in the mix is really important.